Hello guys. So now we shall be discussing regarding the occipital bone. Okay. So let us discuss what are the structures of the occipital bone. So basically the occipital bone, right, lodges your occipital part of your bone, which is occipital part of your brain, which is also called as a visual cortex, right. So the cortex that is responsible for the vision is the occipital lobe. Where is occipital lobe present? Inside the occipital bone. This particular occipital bone, if you remove it from the rest of the bones, this looks like a trapezoid shape. So the occipital bone looks like a trapezoid shape. The shape is trapezoid. Now this occipital bone has got three important parts. So what are these three important parts of the occipital bone? One is called as a squamous layer. Okay, one is called as a squamous layer. Second important part is called as a condylar part, and third important part is called as a basilar part. So there are three parts here. One is called as the squamous layer, next we have got the condylar part, and third is called as a basilar part. So let us look at this occipital bone right now. So this is how the occipital bone is present. First I will draw just a rough picture and then we shall look at the occipital bone in detail, okay. So this is the rough diagram of your occipital lobe. This is the rough picture of your occipital lobe. And remember one thing, that above here you have got a very interesting structure, and even following these lines also you have got one more interesting structure over here. And in the occipital bone, you know the largest foramen which you have got, what is that foramen you call it as? That foramen you call it as occipital foramen, right? So let us say that this particular foramen which you can see over here is called as your occipital foramen, okay. Now next important thing is, see this part whatever I am shading right now, right, so this is called as your cortex of your occipital bone, okay. So this is called as a cortical part of the occipital bone. So overall, I know it is not looking exactly like the trapezoid which I have drawn over here, but just think that it might be looking like a trapezoid. When you look at the actual bone, you will understand. So in this, what are the different structures which we have got? See, so basically guys, when we are discussing the occipital bone, there are two surfaces within the occipital bone. If you are looking from outside, that is called as the external surface, right? So if this is the skull, this bone over here is your occipital bone, where it is having a very big foramen over here. This foramen over here is called as your occipital foramen. Now this surface which you are looking here is called as the external surface. Deep inside in the sense, for example, if I remove the skull cap, right, deep inside whatever you see is called as the internal surface. So you have got two surfaces, one is called as the external, another one is called as the internal surface, okay. This surface whatever you are able to see here, this is called as the internal surface. So later I will draw about the external surface. So first this is your internal surface. So in this internal surface, what are the different structures which you can see? First important thing, I told you that this occipital bone is having three parts. What are those three parts? One is called as a squamous part, next is called as a condylar part, and third is called as a basilar part. So if you look here, till here, right, so till here, this part whatever you can see over here, this entire part is called as the squamous layer or squamous part of your occipital bone. So this yellow color part over here is called as your squamous part. After that, next till here, whatever part you can see, right, so till here, whatever part you can actually look here, this is called as what? This is not called as squamous, this is called as a condylar part. See, this entire part over here is called as your condylar part. And after that, the leftover part over here is called as your basilar part, okay. So there are three parts, So this particular part over here is called as your squamous part of your occipital bone. The next, that is surrounding your foramen magnum. All of you know that this is called as foramen magnum. Foramen magnum. So surrounding the foramen magnum, whatever you have got, this is called as the condylar part. Condylar part, and the final part, this green one over here, is called as the basilar part. Basilar part. So there are three parts: squamous part, condylar part, as well as the basilar part. Now within this, there are different grooves which you can see. For example, you see this particular groove on the top. This is straight, this groove is straight. Any sinus which is straight is called as sagittal sinus. So this is called as a groove for sagittal sinus. This is a groove for sagittal sinus. Okay. After this groove for sagittal sinus, this part which is in the center over here, right? So this part which is in the center over here is called as protuberance. Actually, you can look at the protuberance from the back also. You see this protuberance which you can see here, this particular protuberance is called as occipital protuberance, right? So but this protuberance is on the outside, so you call it as external occipital protuberance. But this protuberance we are discussing in the internal surface, so you should call it as internal occipital protuberance. Internal occipital protuberance. Internal occipital protuberance. Below this internal occipital protuberance, this particular structure which you can see is not a sinus, this is called as crest. What is this crest? This is called as occipital crest. But again, the same occipital crest is also present on outside. So this one will be called as internal occipital crest. Internal occipital crest. And finally, we have got a groove over here. This is called as groove for, what is this? This is vertical or transverse. Obviously, this is transverse. So this is a groove for transverse sinus. Groove for transverse sinus. So after this groove for transverse sinus is done, you know what is this part called as? This part is basilar part. This part is basilar part. Actually, in this basilar part, if you see in this picture, in this 2D image which I have drawn here, the basilar part is straight. But actually the basilar part, the last basilar part is in this way. You see it is depressed. So this depression, whatever you can see in the basilar part, is called as clivus. Is called as clivus. And next, can you see a notch over here? This particular notch over here is called as jugular notch. Jugular notch. And there is also one more structure over here which I cannot show it to you now. I will show it in a real image. But for now, what you need to know is that we have got three parts within the occipital bone. What are those three parts? One is called as a squamous, next we have got is a condylar, and third is called as a basilar part. So here, this is the internal surface. The structures which you have got is two sinuses you can see. One is called as a groove for sagittal sinus, and down here you can see the groove for, this is groove for sagittal sinus, and down here you can see groove for transverse sinus. Okay. Now after these grooves are done, next we have to discuss about the internal occipital crest. Internal occipital crest. Here this is foramen magnum, and next structure you have got is a jugular notch. Okay. So these are the structures that are found on the internal surface. Now I will show you the picture and you will answer me these structures. Now look at this. What is the upper part called? From here all the way till here, right? So what is this part over here called as? This part over here is called as a squamous part. Squamous part. Next, from here all the way till here, what is this called as? This is called as a condylar part. Condylar part. And finally, the last green color part, whatever you can see here, this is called as your clivus. Clivus or the basilar part. Now in this picture, I know it is very clear to you that in the center of the basilar part you see a depression like thing, that is called as your clivus. Okay. And what is this opening over here? I mean this notch over here is called as your jugular notch. Jugular notch. And this foramen which you can see over here is called as foramen magnum. foramen magnum. And here I told you occipital protuberance, you see a protuberance in the center over here. So this is called as internal occipital protuberance, internal occipital protuberance, internal occipital protuberance. Next you can also see a sinus on the top. This is called as vertical, what sinus? Transverse sinus or sagittal sinus. This is a groove for sagittal sinus, groove for sagittal sinus. And next you have got another sinus over here. This is called as a groove for vertical sinus, right? Or you can also call it as a crest. This is called as crest, occipital crest. Okay. Where is transverse sinus? See, this one over here is called as your transverse sinus. Transverse sinus. And next important thing is that if I zoom in the picture, you can see a canal like this, you see, right? Again, just look at this canal. So this canal, whatever is here, is called as hypoglossal canal. So this canal is called as hypoglossal canal. Hypoglossal canal. Okay. So these are the structures which you can see from the internal surface, okay, internal surface of your occipital bone, right. Now what I am doing is that, now let us look at the structures that are seen from the external surface of the occipital bone, external surface of the occipital bone. So again, what we shall do is that we shall just draw the picture first and then we shall go into the real picture there. So even the external surface of the occipital bone is also somewhat like a trapezoid shape. The entire bone is obviously like a trapezoid shape. So here you have got a condyle. Here you have got another structure like this. This is also called as a condyle. And right. Now let us look at the structures which we can see over here. In this, there are quite many different things. I mean, the structures are almost overall the shape might be like a trapezoid, but the structures from the internal side and the external side are quite different. Okay. So let us see what are the structures over here. Again here, I'm not going to differentiate between which is the squamous, which is condylar and basilar, because you already know here, right. So now what we shall do is that we shall just differentiate between which is condylar, which is basilar, as well as which is the last part. What is the last part called as? The basilar, and the middle part is called as the condylar, and the remaining part is called as the squamous part. So let us look at the differentiation here. See, this particular part which you can see, right? So this particular part which you can see over here, this entire thing over here is your squamous part. Okay, so this entire part is called as your squamous part. Now after this squamous part, the next important part which you can see over here is called as, see this important thing, this part is called as your condylar part. So this is your condylar part. So this is called as your condylar part. Now after the condylar part, the part which is located in the center like this one is called as your basilar part, you know this. So condylar and basilar part. Now here let us see what are the structures here. The first important structure, this is looking like a protuberance, but this protuberance is from outside. So you call it as external occipital protuberance. External occipital protuberance. Okay. And next, after this external occipital protuberance, you can see two lines. See, this is one line on the top and this is another line in the bottom. So what is the line on the top? This is called as a nuchal line. So this line over here is called as superior nuchal line. Superior nuchal line, from where the nuchal ligament will start. Next important thing is your inferior nuchal line. Inferior nuchal line. So one line is called as the superior nuchal line and the other line is called as the inferior nuchal line. And there is another nuchal line that is located exactly in the center. This is called as median nuchal line. medial nuchal line. This is called as a medial nuchal line. Okay. Next, what are these two structures over here on either side? Yes, what are these two structures on either side? These two structures on either side are called as condyles. That is why you call this center part as a condylar part. And this condyle is a condyle of what? Occipital bone. That is why you call it as occipital condyle. Occipital condyle. Okay. After occipital condyle, again this part is called as a clivus. Again the same thing, right? Now, one very important thing you need to know, above the occipital condyle, we have got a canal like this. Okay. So, this canal which is located above the occipital condyle is called as condylar canal. This is called as condylar canal. Condylar canal. And finally, right? Finally, I think we have covered almost all the structures over here. So, I think from external surface is pretty much easier when compared with the internal surface. External surface we don't have sinuses. Obviously, you don't have sinuses outside, you have inside the brain, right? So, I mean inside the cranial cavity. So, what are the sinuses that are located inside? Two sinuses here. One is called as your sagittal sinus and transverse sinus. So, here if you look, there are pretty important things which you need to consider. One is called as external occipital protuberance. Next one you have called it as the superior nuchal line. Next you call it as the inferior nuchal line over here, right? After that you have got the median nuchal line. Next you have got is your condylar canal and occipital condyle. So these are the structures that are located externally. Now look at the real bone and then let us name these structures. So again, what are the structures here? This is just for the revision part. So this particular structure over here is called as your external occipital protuberance. This is called as your external occipital protuberance. And this line over here is called as your superior nuchal line. Superior nuchal line. Okay. Next, this one in the middle is called as your inferior. See, this one over here is called as your inferior nuchal line. Inferior nuchal line. And the line in the center here is called as a median nuchal line. Median nuchal line. Okay. Next, here what do you have? This is called as a condyle. Condyle of the occipital bone. Condyle of your occipital bone. Above these condyles, whatever canal you have got is called as a condylar canal. Condylar canal, right? Now, important thing you need to know over here is that, guys, now don't confuse with this particular arrow. This arrow and this arrow, both of them are indicating your superior nuchal line only. Okay, so that is why I put a cross mark over here. Now, what we shall do is that once after discussing the occipital bone, now what we shall do is what are the muscles that are attached to this occipital bone. Obviously, when I tell muscular attachment, you should think what? You should think that what are the muscles that are attached to the external surface of the occipital bone. There are quite many muscles that are attached. Let us look at these muscles with the help of the pictures and try to understand them. Just look at this muscle. This muscle is attached to the occipital lobe. Yes. This muscle is attached also to the frontal lobe. Yes. From the occipital lobe all the way till the frontal lobe, you call this muscle as occipitofrontalis. So this is occipitofrontalis muscle. Okay. First what we shall do is that let us write down the names of these muscles and then let us look at the actions of these muscles. So names are very important. One is occipitofrontalis. Next, if I am little bit rotating this person to the back, if I am looking from the back side also you have got two muscles. So what are these two muscles? Now don't concentrate on these muscles. These muscles are occipital muscles, right? So these were the occipital muscles which I drew, which I have shown you in the lateral picture. Now here, don't concentrate on these muscles, okay? Because these are your occipital muscles. Next, down here you see muscles which are longitudinal. You see some longitudinal muscles over here. See, down here you see some longitudinal muscles on both the sides, right? So these muscles are half and half. They are located along the spine. So these muscles are called as semispinalis. semispinalis. You see down here they are attached to the occipital lobe only, occipital bone. Yes or no? So this is attached to the skull. So semispinalis capitis. Semispinalis capitis. Okay. Now after that, look at the next muscle. Now if you look at this muscle, here previously here there was semispinalis capitis like this. Look here, previously here there was semispinalis capitis on both the sides. Now lateral to semispinalis capitis, you see these group of muscles here as well as here. These muscles are called as obliquus capitis superior. These muscles are called as obliquus capitis superior. Okay, so these muscles are called as obliquus capitis superior. So where are they located? They are located on either sides of your semispinalis muscle. Now after this muscle is done, look at another muscle here. What is this muscle over here? You see the name of, you see the muscle here is in the trapezoid shape like this, right? So the name of this muscle is your trapezium. The name of this muscle is your trapezium muscle. Okay. Now after this trapezium is done, the last muscle over here which you can see, a string like muscle which you can see, right? So this string like muscle is long. So this is called as longissimus capitis. This is called as longissimus capitis. So this muscle over here is called as your longissimus capitis. So what are the different kinds of muscle we have discussed, guys? So we have discussed quite many muscles over here. The first muscle we discussed was occipitofrontalis. Next down to that we have got semispinalis 2, and next side to semispinalis we have got obliquus capitis superior, and next trapezium over here, and finally longissimus capitis. Now what is the action of this occipital frontalis? What is the action of this occipital frontalis is that we basically have got three important actions. What are those three important actions? For example, if I am able to move my scalp, you see I am able to move the scalp in the sense not this one, this is your head, right? The scalp here, you can move the scalp like this, yes or no, front and back. So it is responsible for the movement of the scalp. It is responsible for the movement of the scalp. Next, if I am able to lift my eyebrows like this, you see I am able to lift my eyebrows in this way, left, right, both, right? I am able to dance my eyebrows. So if I am able to lift my eyebrows, right? So this lifting of eyebrows is done by your occipitofrontalis. So lift eyebrows. Third important thing, when I am lifting my eyebrows, you see the wrinkles that are formed on the forehead. These wrinkles are also formed because of this occipitofrontalis. Wrinkle of forehead is also formed by this occipitofrontalis. Next, when you look at the semispinalis, what is the use of this semispinalis? This is responsible for the extension and rotation, right? So I am able to extend the neck, right? I am able to extend the neck. I am able to even rotate the neck. So extension and rotation of the head, not only head, even this muscle is attached to the cervical region, even to the thoracic spine. So even the head, cervical and thoracic spine okay. Next important thing is, what is this obliquus capitis superioris? I think the function of this muscle is almost similar to this muscle, because these both muscles are located side to side. Little bit laterally to semispinalis you have got this obliquus capitis superior. So this will also do the same function, that is extension and rotation, but one additional function is lateral flexion. See, if I am able to laterally flex my neck and if I am able to extend my neck, it is all because of this obliquus capitis superior. So it is responsible for extension and lateral flexion, of your head, And finally, you have got your trapezium, right? So the actions of trapezium, there are many actions of trapezium. So I have talked the actions of trapezium in detailed in the lecture of the upper limb. Okay, but still anyways I am going to tell you the actions here. So if you look at the trapezius muscle, there are three basic actions of the trapezius. Now you see here, this entire trapezius muscle is attached to the scapula, right? So I can divide this trapezius actually into three groups. See, this is one group, this is another group like this. Okay, so this trapezius is divided basically into three groups. What are these three groups? You see these fibers which you can see here, these are on the top, right? There are another group of fibers that are located medially over here. Okay, next there are third group of fibers that are projected all the way down over here like this. There are three groups of fibers. Now for example, if you are pulling the superior group, so how I can divide is that trapezius muscle is divided into three fibers: superior group fibers, middle group and inferior group. Okay, so let me rub this out. Let me just draw two lines over here. Right, so here if you see, this is superior group fibers, this is called as a middle group fibers, this is called as a inferior group fibers. Now you tell me, if superior group fibers are contracted towards the spine, what will happen? Will the scapula go down or it will go up? It will go up. So that is called as what? Elevation of scapula. So can I write it here as superior group fibers are responsible for elevation of scapula? Elevation of scapula. After that, if you look at the medial group fibers, when they contract, the scapula is moving towards the spine, right? So this is called elevation of scapula. And if I am doing this action, this action, what is happening? Both the scapulas on the back are touching each other, right? Actually they are not touching each other, but they are moving towards the midline. So these group of fibers are middle group of fibers which are responsible for a retraction of scapula. So this action is called as a retraction. Okay, so they are responsible for the retraction of scapula. So two actions you have got, one is called as the elevation of scapula, next is called as the retraction of scapula. Third important thing is that if these group of fibers are contracted, you see the scapula is moving down, right? So this is called as depression of scapula. The inferior group fibers are responsible for the depression of scapula. So whatever you have told here are the actions of scapula, but you also have to remember that this particular muscle is also attached here to the occipital lobe. You see, the occipital bone. So what actions it can do here? One is called as rotation, another one is called as lateral flexion, another one is called as extension. Extension, rotation and lateral flexion of what? Of head and neck. Why? Because this muscle is also attached to the occipital bone over here, right? So apart from these actions, it will perform three more actions. One is called as the extension, another one is called as the rotation, another one is called as the lateral flexion. Lateral flexion of the head and neck. Lateral flexion of the head and neck. Okay, so these are the actions of the trapezium. Next, when it comes to the longissimus capitis, the same function, rotation and flexion of the head. So it performs rotation and flexion of the head. Rotation and flexion of the head. Okay, so that is done by this longissimus capitis. So overall guys, what are the important things we have discussed so far? Let us just revise this. We discussed that occipital bone is trapezoid shape. It is having three parts. One is called as the squamous layer, condylar layer and basilar layer, right? So you can see here squamous layer is the vast and basilar layer is the small, right? Next, this is the internal surface. Internally what do you have? You have got internal occipital protuberance. Two sinuses you have got. One is called as a sagittal sinus, another one is called as a transverse sinus. After that you have got what? Internal occipital crest. Next you have got foramen magnum, you have got jugular notch, okay, and the down here you have got is a clivus. Coming to the external part has got external occipital protuberance, superior nuchal line, inferior nuchal line, and then the center, this nuchal line is called as a median nuchal line. Next, Why are you calling it as condylar part? Because you see two condyles on either side, right? Above these condyles you have got condylar canal. So if possible I can show you the condyles which are not visible, right? So here you can see this part and this part, these two are called as the condyles over here, right? That is why you call it as a condylar part. Down here above the condylar part, you have above the condyle, occipital condyle, you have got a canal called condylar canal. Right. Next, coming to the muscles, occipitofrontalis, semispinalis capitis, obliquus capitis superioris, trapezium as well as longissimus capitis. These are the muscles that are attached tightly to your external surface of the occipital bone. Okay. So, this is all you need to know regarding the occipital bone. Thank you so much for watching my video. Goodbye.